Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Water. You got to drink it, right? But it has to go somewhere. And if this is not functioning right, because it has to go out from there some other place. And so today we're going to talk about something very important in your whole muscular. You know, you have muscles here, muscles here, muscles here. But nobody talks about the muscles down here. Very important muscles, because it can be very embarrassing. If your muscles down there don't work, you will urinate on yourself when you laugh. Or you will urinate on yourself when you sneeze. Maybe you out there, are you sneezing now, getting a little urine coming out? Yeah. Urine has an odor to it. You know, and of course people can detect that if it's in your clothing and things like this. And years ago, women who had that kind of thing, they used to call it incontinence. That means they can't hold urine, you know, as if they sneeze or laugh or things like that. So they used to wear black clothing. They wear black clothing because at least they could cover up the looks of somebody urinating if you had a nice dress on and so forth. But with black, nobody paid any attention, but you still had the odor. Today, we're going to talk to somebody in this field who's put a lot of time in this field. Very seldom you go to your doctor, and he even, except maybe doing a rectal examination or a pelvic examination, does he talk about that whole unit down there, this unit right at the bottom of your body, right down in this area here, is where all of these muscles are and things that control your urination and moving your bowels and all this kind of thing. And sometimes these muscles get very weak with age and other things, and sometimes just from strokes and things like this. So we're going to talk to someone that really has put some time in this and effort into this teaching. I think that all doctors should be looking at this program right now. All the doctors should be looking, because a lot of times in school, it's not explained that well. You do the anatomy, you dissect, but nobody talks about function, you know, and that function is so important. So I welcome Dr. Professor Sable here at Downstate Medical Center. Richard, I'll call you Richard, and you can call me Jerry.
Okay.
Richard and Jerry. Give me just a little bit of your background. What's your basic interest that you here at Downstate, and you teach here at Downstate?
Well, you know, I'm an occupational therapist.
Okay.
And as part of my training, we never really talked about the pelvic floor.
Right.
Certainly, I've worked with people all the time who are dealing with incontinence. I may be dealing with somebody who has MS, or somebody who's had a stroke, right? They have what's called a neurogenic bladder. It's harder to control, or many people get weaker bladders, as you mentioned, or weaker pelvic floor muscles and have incontinence. Mm-hmm. But we never talked about really the pelvic floor muscles and how to really help people find ways to develop better control. What's
you mean,
the best?
In other words, strengthening?
Yeah, strengthening of the pelvic floor muscles.
Right.
And what happens in nursing homes, for let's say, when people have urinary incontinence? It's simpler to put a diaper on someone. And when you put a diaper on someone, what do you teach them? Go in the diaper. I was watching TV just a few nights ago. I was drifting off, and all of a sudden I saw Whoopi Goldberg. And I'm thinking, am I dreaming, or is this really happening? And Whoopi Goldberg was in this commercial advertising pads.
Okay.
For people to wear, because things happen, the leakage, just like you talked about.
Sure.
So it's something that we're starting to talk about, because it's a huge issue.
Huge issue.
For
right.
women, which
Mm-hmm.
I didn't know until I started to think about this. 1/3 of women who have had a child, so women 35 and older, are dealing with stress continence, which is what you just talked about. If you sneeze, if you cough, if you stand quickly, if you squat, anything that creates increased abdominal pressure,
Sure.
like a good hearty laugh even,
Yeah, sure.
can create a little bit of leakage.
Sure.
So 1/3. Maybe even higher because of underreporting, because people are self-conscious. They don't want to necessarily talk about it. So in my work as an occupational therapist, I started to discover the pelvic floor, but indirectly.
Mm-hmm.
What happened was, I first started to think about breathing, because I noticed that many of the people I worked with were not breathing as efficiently as they could. Meaning they were taking a shallow breath, doing chest breathing, things like that, breathing up here and not having a good, easy breath. And if I'm working with people to improve their strength and their endurance and get back to doing activities of daily living, doing activities that are meaningful to them in their daily life, and they're not breathing well,
Right.
then I thought, maybe I'm missing a very important piece. And in my learning about the respiratory diaphragm,
Okay.
I learned about the pelvic floor muscles.
Now, when you talk about the respiratory diaphragm, explain the diaphragm.
Okay, so when we breathe, we have a big, huge muscle that basically, if you feel your sternum and then you touch your ribs around here, that's diaphragm. It's a big muscle, attaches all the way around it. It separates your lungs and your heart from all your abdominal organs. It's right in between. And every time we breathe, it pulls down and helps air come into our lungs, keeping it very simple, right?
Surely.
So, but I didn't know another important piece that helps your breathing or respiratory diaphragm work with the muscles we're talking about right now at the bottom of our pelvis.
Right.
So let's use this. This bowl represents my pelvis.
All right.
And the bottom, the floor, the bottom of the bowl represent the muscles of the pelvic floor, right? They're at the bottom of my pelvis. It's also, these muscles have been referred to or could be called the pelvic diaphragm.
Oh, okay.
So we know them as the pelvic floor and pelvic diaphragm.
Right.
So every time we breathe, this hand here represents my breathing diaphragm.
Right here.
This one represents my pelvic floor. If I'm breathing, when I inhale, they both move down.
I see.
And then they both move up when I exhale. Breathe in,
I
they go down. When I exhale, they come up.
I see.
So it's called the dance of the diaphragms.
Dance of the
Now,
diaphragm.
I never learned that
Is it
originally.
usually with jazz or
It could be
symphony
jazz,
music?
blues. It doesn't discriminate. All music, right? But
Okay.
every breath, this happens.
Oh, right, yes.
So when I started to learn about breathing, I found that if those muscles of the pelvic floor or pelvic diaphragm are too weak, which is very common, especially among women,
All right.
muscles are very weak, it restricts the respiratory diaphragm from working. And if those muscles, the pelvic floor muscles, the opposite can happen where they could be too tight, which is more common in men than women, that will also restrict the movement of the respiratory
Now,
diaphragm.
you say women. Is there something particular about women why they should stretch out of shape?
Yeah, two things. Well, first off, having a baby, right?
Okay.
You think of a big baby coming through a small space, really stretching the muscles, right?
Right.
But also the pelvic floor muscles, which make up the bottom of this bowl. Women have a third opening that men don't have. We have the Aretha and the anus. Both men and women have that, but then you have the vagina, right? There's a third opening for women. So structurally, there's going to be more weakness in women than men. So they're more susceptible to the weakness in the pelvic floor. So
Right.
it was learning about breathing. And if the pelvic floor doesn't, pelvic diaphragm doesn't move with the breath, then we don't breathe as efficiently. But we breathe in and out over 20,000 cycles of breath a day. We breathe a lot,
20,000.
20,000. So if I can get the pelvic diaphragm to move throughout the day like it's designed to do,
Right.
I can help to maintain the strength and flexibility of those muscles.
Wow.
Because if I'm not using it, I'm losing it,
Right.
right? So if a man is too tight, it's not moving, or if it's too weak, it's not moving. So we want to, when we're thinking about the pelvic floor muscles, we want the muscles to be able to both lengthen and shorten, right?
Right.
Adaptability, flexibility, things
There's
like
an
that.
exercise associated with that, isn't it? What's that?
Well,
To
very
strengthen it.
common. Okay, so let's talk about stress incontinence
All right,
in women.
right.
So again, stress incontinence, that little bit of leakage when you cough, sneeze, jump, laugh, whatever.
Right.
So a very common, do a Kegel exercise. And a Kegel exercise is basically the person is told, think about if you were urinating and you tried to stop the urine flow, that squeeze that you would do, those are muscles that you want to strengthen. So they'll be given a piece of paper, typically, and the piece of paper will say, so what you do is you squeeze that muscle, hold for 5 seconds, then relax that muscle for 5 seconds. Or it might say hold for 10, relax for 10, some variation of that.
Right.
And people just do that, but they're really not given instruction. And how do you do that really properly?
Right.
Because the pelvic floor is pretty big. I mean, it's not big, but there are a lot of muscles that
That's right,
comprise the
surely,
pelvic
surely.
floor. The front portion of the pelvic floor, where the urethra, where we urinate from, those muscles are naturally weaker. The back muscles around our anus are much more powerful. And oftentimes when people are just given that piece of paper to do a Kegel exercise, they're not really focused enough, specific enough on those muscles in the front that deal with urination.
I
So
see.
they may be developing those more powerful muscles around the anus rather than giving more effort to the muscles up front. So the
Right.
exercise, if not done properly, won't provide as much benefit. If done well, they're very helpful. But I've learned something. It's not just about doing Kegels. It's Kegels and more. There's a wonderful book by a woman named Janet Holm called Beyond Kegels. There's a little bit more to the title, but it's really more than just doing a squeeze of those muscles, the sphincter muscles, and relaxing. It's focusing. When I work with a client now, and I work with a number of people that have different kinds of pelvic floor issues, incontinence being one, but then many other kinds of pelvic floor disorders. But I approach it the same way. The beginning is starting with the breath. It's having people start to feel that when they breathe in, the pelvic floor goes down, and then when they exhale, it comes up. And I have them start to feel that in their own bodies, right? We can't do that here now, but it's a process that doesn't take very long. And then I have them, when they exhale, to gently lift up the pelvic floor and then totally relax it when they inhale. So they start to help the muscle relearn, hey, when I'm breathing throughout the day, I can be doing work. Use it or lose it, like we said before. So right away, we're teaching that muscle to work throughout the day rather than just those few minutes that we're doing Kegel exercises.
Right, surely.
And then there are other muscles in our body that really work with the pelvic floor.
Right.
So you want to think about those muscles as well.
Well, you know, you used this at the beginning here as the pelvic floor. What sits in the pelvic floor? It's certainly not empty.
Nope. All right, so you got this bowl, and I'm going to put it right on my lap, which is sort of appropriate. And then inside here, depending upon male or female, we have a bladder.
All right.
We have the rectum. We have, if it's a male, we'll have the prostate. We have, okay, help me with my name, bladder, uterus, right?
Uterus, that's right, sure.
And all these pieces of ourself in this very, very small, tight place.
Yes.
Now, pelvic floor muscles are the very bottom. So there's some weight here, right, from just these reproductive organs, elimination organs, right? But then we have all these other organs on top.
That's right, sure.
Right?
All right.
So you think about all this weight that's naturally there on these muscles throughout the day, so they can be, there's a lot of stretch there.
Surely.
So if anything goes wrong, right? If there's any inflammation or irritation in this area, it can create a lot of pain and discomfort, as well as what we're talking about incontinence.
Continence, yeah, surely.
So small space, a lot of really important parts of ourselves within this small space.
Surely.
And it can really, doesn't take much to set things off, but it's real easy just with good habits and good practice to keep everything functioning well.
Right.
So for women, let's talk about women for a minute. Those muscles, if they're weak, I'm going to show you something.
Okay.
I'm going to take this. This straw represents your urethra,
All right.
May I have your hand? It's not a proposal. Okay. This is a pelvic floor,
Right.
your hand. This is the urethra.
Right.
If the muscle is doing its job, it's a little bit tight, so it creates a little bend in the urethra. So if the straw is bent, water won't pass through that, right?
Right.
It'd be very hard
That's
for me
right,
to
sure.
sip
Of course.
a beverage from the straw. So let me put this back. But if the muscle's weak, it doesn't put the pressure on the urethra, right?
All right.
So it's straight, and the water, or in this case, the urine, can leak out.
Oh, I see, yes.
So a woman loses that protection.
Yeah.
So
yeah.
if the pelvic floor is working, there's a little bit of a bend if the muscle tone is right. If it's too weak,
Right. How about the male with the prostate, for example?
prostate's a different issue, right? Because the urethra passes through the prostate. So for men, they have an issue more common of as the prostate can enlarge
surely.
and the urethra goes through the prostate, it can put pressure on the urethra. So a man has
in other
difficulty.
Words, this is the prostate.
That's
That's
right.
going right through there.
That's going right through that.
Right.
And the bigger and bigger it gets, it can squeeze
you
here
go.
and make
Yeah.
it very hard.
I see.
Now,
I
for
see.
men, if they have their prostate surgery and if the prostate is removed, many men will deal with stress incontinence post-surgery.
Right, yes.
Right? So women are dealing with it, but we tend to think incontinence is an issue for older people, but that's not true.
That's right,
As I
surely.
said before, women 35 and older
Surely.
tends to increase a little bit once maybe we're in our late 70s or 80s, but not significantly.
Right,
So it's an issue that so many people are dealing with. And there are simple things to do with it. But here's a key thing
All right.
in my work that I found. How many people like to do exercises? Not many, right?
No,
if you're
of
given
course
an
not.
exercise program by a therapist,
Sure.
most people will start out doing it initially,
All right.
but will give up.
Surely.
Right? So another piece of this program that we've thought about with the pelvic floor is, as I said, when we start with the breath and the muscles are relearning how to move, so we keep them moving and using them throughout the day, Once people understand how the muscles move, we can start to use them in simple, everyday activities.
Okay.
So how many times a day do you get up from a chair?
Well, I would say at least 50, 20, 25 to 50 times.
Right? How many times do you maybe bend or squat during the day to lift something?
Sure, all the time.
So what a simple thing to do when you work with people is once people understand that when you inhale, the pelvic floor can go down, and when you exhale, you lift up.
Right.
You can teach people that when they're sitting and they go to stand, you take a breath in, and then if you exhale and lift up on those pelvic floor muscles, you're really strengthening them, but you're also teaching those muscles how to function in everyday activity.
I see.
When you're holding something that you want to pick up, or let's say you want to lift up a bag, I take a breath in, I exhale, and I lift up on those pelvic floor muscles.
Right.
I'm now using these powerful muscles that are at the bottom of my pelvis to help me stand, to help me lift, to help me move in bed. And I'm using muscles that I've not used probably most of my life that are now making not only that movement easier, but I'm keeping those muscles healthy and strong.
Well, you know, when I came into medical school many years ago at Downstate Medical College here, and we had to dissect the pelvic floor, I would think that in anatomy it would be very profitable for the student and his later work in medicine to have someone like yourself to explain this while they're dissecting that floor to be able to help patients. Because it's all right to give a patient a pill to urinate more, a diuretic and so forth, but at the same time, you're not teaching them how they're going to make that floor strong enough to hold that urine after you give them that water pill, which is coming out maybe every few hours, and now they're urinating on themselves there with a diuretic. I find that medical school, it's great in everything, in many ways, but it doesn't give the functional part when you're dissecting. And a person like yourself should be in the anatomy department to take that part of that dissection. So they would be just knowledgeable as not only students, but interns and residents. No one knows, no one talks about these things.
That's right, and that's a great point. When I first started to think about the pelvic floor, I was at S.U.N.Y Medical Center, and they have a really good, what they call the Carpus Health Information Center. It's like a community center that's near the hospital, and I used to do groups there, different kinds of groups. And then when I got interested in the pelvic floor for all the reasons you and I are talking about, I said, could I do one of my groups but do it on the pelvic floor? And they said, who's going to come to that? So they said, let's not do that. But about 6 months later, I approached them again, and they said, okay. Now, normally my groups were 6 weeks. I do them like on Friday, 6 weeks in a row. I said, how about we do it for 3 weeks? And they agreed. And they put out a beautiful catalog of all the different programs they offered. And the first day that catalog went out, and I was going to have 25 people in the group, they called me and said, the group's filled up. Would you be able to do another group?
Right.
The next day, they called. We filled the second group. Would you be willing to do another one? Over 150 people called. In the 20 years that community service has been available, they've never had a response like that to the program. It was just a little description of what it offered.
Yes.
So the first time, rather than doing small groups, which I ultimately did, but I had everybody come together for one initial presentation of the work, and then we met in small groups. And the first time I had about 100 people in the room.
Right.
And I said to all just regular everyday people, I said, how many of you, when you're dealing with a health professional, any health professional, whether it be a gynecologist, your regular general practitioner, whatever, a nurse even, occupational therapist, has that health professional initiated a discussion with you about a pelvic floor issue?
Right.
And out of 100 people, 2 hands went up.
Sure.
And the Carpus Center where I was doing this, again, they've been around for a long time. They never had a response.
Right.
To a program, like as many people coming out. And we've done that program 4 times with the same response each time. There's always a big waiting list because there's a tremendous need in the community that's not being addressed. And I agree with you. Health professionals, we need to know to ask the question.
Definitely.
And then if you're a health professional that's not skilled in it, then we'll obviously refer to the appropriate person because there's tremendous need. Because if you are leaking, like you talked about before, it impacts quality of life big time.
Of course.
If I have to start thinking about, okay, I have stress incontinence. And my friends say, let's go out and play. Let's do something. Well, then is there going to be a toilet nearby? What are the activities? What clothing should I wear, right?
Sure.
Am I going to be able to handle this? And unfortunately, what do people do? They may put on black clothing, but many people then disengage a little bit. They don't socialize as much. They withdraw a little bit. And the more any one of us, for whatever reason, does less, it's not healthy, is it?
And
On many levels.
certainly the diaper is not the answer. I mean,
No,
you
but
know, when I say diaper is not the answer to make you presentable or have a decent odor about yourself, because a diaper holds odors too.
Right. And who wants to wear a diaper the rest of their life?
That's right, of
but
course.
But there's another important piece, that when we have weakness
Right.
in the pelvic floor muscles, and we have all these factors. Remember, a lot of people are younger, so think about intimacy,
Oh yes.
right? What if you know that you're going to leak a little bit? Is that going to make you feel comfortable being intimate with somebody?
That's
right?
true, sure.
You're going to disengage socially.
Right.
The other thing is, because those muscles, the pelvic floor muscles, are weak. Remember, I talked at the very beginning that they make up the floor of the core. You have the pelvic floor, the respiratory diaphragm, your abdominals in the front, muscles in the back, right? That's your whole core. Very common when people have stress incontinence, they also have back pain or knee pain or hip pain, because the pelvic floor muscles are vital muscles to function.
Sure.
And if those muscles are weak, it puts extra strain on the back, it could put extra strain on the hips and extra strain on the knees. And very common, people with stress incontinence also feel discomfort in those areas, or one of those areas, not uncommon. So when we really think about the pelvic floor, if I have a weak pelvic floor, I'm not breathing as well as I could possibly. So I'll have less energy to do the things I care about.
Of course.
Right?
Of course.
Then also I might be leaking, right? And then also I might be dealing with physical pain and discomfort because I don't have that balance, right? There's a real significant imbalance in the way my muscles need to work together.
Sure. And just think about resting. I mean, at night, for example.
right.
Think, you know, we as doctors are very glib to give out diuretics. They make you urinate to keep your blood pressure down, but they don't discuss the disadvantages of that diuretic from the standpoint of physical movement of your whole body and things like this. So many people are awakened at night and can hardly get to bathrooms before they stump their toe and so forth, you know.
Right.
You know, and in the dark and things like this, because they can't hold it until just 10 feet. They can't hold it till they get to the toilet even, you know. So some start having a commode next to the bed. Well, that's not the most...
No, not a good way to be. And you really think about sleep deprivation. If I have to get up 2 or 3 times a night, or if I'm at work and I have to keep running to the toilet.
Right, surely.
Right, in all these key areas. And what about fall prevention? When you have that urge to go.
Oh, yes.
How many people will, especially when you wake up at night and you're a little
fall.
bit sleepy, you're not quite focused, you move quickly to get to the bathroom and you fall.
And there's the hip.
Hip, or the head,
Oh,
right?
yeah,
Hip.
sure. Oh, boy.
And then the hip.
Yeah.
If we break our hip, and that's not uncommon, people have a hip fracture, or some people later have a hip replacement surgery, right? A key muscle that attaches to the hip becomes part of your pelvic floor. And it's not uncommon that after a hip surgery, people may have issues with continence because the pelvic floor has been a little aggravated from that surgery.
Now, I wonder how many orthopedic surgeons explain that to the patient that this might happen.
Not many that I'm aware of
surely.
at this point. I'm sure there are
So that
some,
should
but
be
it's not
part
a
of the
common
whole,
piece. Yeah.
That should be part of the whole, when you have surgery of the hip, part of the whole explanation of things can happen also, you know. So, such as strengthening the pelvic floor and things like this.
And people want the information. All that group work I mentioned to you before, people really are interested and want to learn about their pelvic floor and improve the health of the pelvic floor for all the reasons we've been talking about.
Well, you know, just recently I had written a poem concerning What's the Matter, Bladder? For you out there. What's the matter, bladder? It seems that things aren't right. You're not letting me get my rest. I'm urinating both day and night. I know that you're getting older and your last nerve is on the line, but you just have to get a hold of yourself when I try to go out and dine. You're making me get up 3 times a night, and often in a darkened room I've stubbed my toe on the edge of the bed, and holding back the flow was doomed. How can I make peace with you? You know I love coffee and wine. I'm aware that caffeine and alcohol irritate you, but you're going to have to give me some time. I know that how to calm you down with a new drug right on hand, but I also help, you can do other things, I'm sure you'll understand. You may be getting infected by a host of other things. I no longer flush while sitting because I know what that can bring. I drink at least 6 glasses of water daily with concentrated cranberry juice in between. I'm only trying to help you to resist infections that can be mean. I'm aware that the muscles on my pelvic floor have become weak with aging and time. And I've been doing those pelvic exercises. I'm sure they will strengthen and be more kind. I even got my prostate gland checked to see if it was squeezing too tight. But the size was normal and the PSA was down. The doc said everything was all right. I hope we can come together and respect each other's needs, because you certainly know that you need me, and I'm sure I need you indeed. And so thank you for a wonderful discussion.
Much. Yeah.
And certainly a number they could call.
Well, you can reach me here at Downstate,
Okay.
Which would be 718-270-7732. I'd be happy to take calls from people if they have questions.
Well, I'm telling you, you'll be very busy. So you folks out there, pay attention to your bladder, what's the matter, bladder, and I think everything will be all right.